Good afternoon, everyone. Lovely to see you all. My name is Shaheen Mannan. I'm one of the clinical pharmacists working in geriatric wards. So today we are going to talk about our study on tricyclic antidepressant used for neuropathic pain in older adults at Middlemore Hospital. So this study was conducted during the period of 1st of September to 30th of November 2017. Just a little bit, just a background about the study. We know pain increases with age due to normal age-related physiological changes and comorbidities. Neuropathic pain in older population is common and significant. It is a chronic condition which doesn't respond well to opioids. So conditions like stroke, diabetes, cancer, surgery can cause neuropathic pain, and these conditions are very common in elderly. As per best practice journal, tricyclic antidepressants, gabapentin, or pregabalin are the first line treatment for neuropathic pain. Several randomized control trials and meta-analysis demonstrate the benefit of TCA's use for neuropathic pain. Even though BPAC recommended gabapentin and pregabalin as the first-line treatment for neuropathic pain, but gabapentin required special authority approval until the 1st of June 2018, and pregabalin required special kind of funding. Among all the tricyclic antidepressants, amitriptyline and nortriptyline are most commonly used, and they have been widely used for more than 40 years. Even though there is no supportive, unbiased evidence for a beneficial effect of tricyclic antidepressant, as per 2015 Cochrane study, still TCAs remain the first choice of drug for neuropathic pain, because we didn't have many medications available to treat neuropathic pain. As I said, gabapentin was not subsidized, no, it required special authority number, and pregabalin required special funding. So treatment plan needed to be balanced against decade of successful treatment in many people with neuropathic pain. Elderly patients can be particularly sensitive to the anticholinergic actions of TCAs, and TCA use may contribute to falls, delirium, postural hypotension, urinary retention, etc. So therefore treatment plan needs to be based on the side effect profile of the medications, interactions with the existing treatment, comorbidities, and also it requires very close monitoring of side effects like anticholinergic side effects, cardiac side effects, psychiatric side effects. So the aim of our studies were to determine the prevalence of prescribing of TCAs for neuropathic pain at Middlemore Hospital, to determine the prevalence of prescribing pattern of amitriptyline versus nortriptyline in older adults over 65 years old. And we wanted to actually highlight the relative drug profile of amitriptyline and nortriptyline to prescribers, notably the differences in their anticholinergic and other side effects. Have I missed? So nortriptyline is a metabolite of amitriptyline that has less side effects, less anticholinergic effects, and it is less hypotensive. So evidence shows that it is safer to use in the elderly, in a sense that it has got less side effect profile. So this is another slide showing which shows that nortriptyline has a better side effect profile. So a retrospective audit of older adults admitted to the main specialty wards, medical, surgical, and RHOPS wards at Middlemore Hospital was conducted during the period of September to November 2017. Medical notes from clinical records were accessed to gather information on demographic data, TCA use, dose, indication, continuation post-discharge, and prior ethics approval was obtained from CMH Research Office. So now I will ask June to discuss the results of our study. June is one of the ARHOP pharmacists and one of the co-investigators.
Thank you, Shaheen. So there were a total of 192 patients prescribed with the TCA in Middlemore Hospital over 3 months. 58% were prescribed with amitriptyline and 42% were prescribed with nortriptyline. Regarding the subject demographics, the average age of patients on either TCA was around 76 years of age. The average dose was 17 milligrams a day for either nortriptyline or amitriptyline. The dose range for amitriptyline was 5 to 100 milligrams a day, whereas for nortriptyline it was 5 to 50 milligrams a day. So the GPs most commonly initiated TCAs. 45% of patients had TCA started in the community. 11% of patients were started by a medical team at Middlemore Hospital, followed by 7% in surgical teams and 5% in ARHOP teams. The medical team studied a similar number of amitriptylines versus nortriptylines, 7 amitriptylines versus 6. The surgical team prescribed more amitriptyline than nortriptyline, 7 versus 4, and ARHOP prescribed more nortriptylines over amitriptylines, which was good to see, so 2 versus 6. 10 patients stopped a tricyclic antidepressant due to an adverse drug reaction such as postural hypotension, dizziness, or hyponatremia. 8 changed to gabapentin, and 3 stopped because of falls risk. The limitations of the study include, firstly, the small population size. Secondly, Middlemore Hospital population may not be representative of the New Zealand population. Thirdly, it was a challenge to confirm the indication of TCAs as neuropathic pain because there were various types of pain, such as cancer pain, and we couldn't directly contact the patients, so we had to rely on limited documentation. Lastly, there was limited comparison studies of efficacy between nortriptyline and amitriptyline in the literature. So, as was previously mentioned, there is no supportive unbiased evidence for a beneficial effect of a TCA, according to a 2015 Cochrane study. It has to be balanced against years of successful treatment in many people with neuropathic pain. So in summary, if TCAs have to be used for neuropathic pain, then we would definitely recommend nortriptyline over amitriptyline due to the better side effect profile. And nortriptyline is an active metabolite of amitriptyline, and amitriptyline has been more commonly prescribed in the elderly population for neuropathic pain. And other options include gabapentin and pregabalin, which don't need any special authority, and we have to be aware that they are renally cleared. Thank you. Oh, by the way, in future studies, basically, now that gabapentin and pregabalin are funded, we might see changes in prescribing practices. So it would be interesting to see the prevalence of prescribing of TCAs, gabapentin, and pregabalin to compare the efficacy and side effect profile.